I'm Dr. Gregory Albert, board-certified plastic surgeon. Let's discuss male breast reduction. Gynecomastia is breast tissue in men. Men with this condition will avoid activities such as swimming, exercise, and sex to avoid exposing their chest. With a rather simple procedure, men feel liberated. They're able to take off their shirts and wear clothes more comfortably.
Dr. Albert offers complimentary consultations. Visit our office in Delray Beach. Call 877-3-ALBERT today.
The mid-facelift, sometimes referred to as a cheek lift, rejuvenates the center of the face in an area from the corners of the eyes to the sides of the mouth. Underlying muscles and fat that have sagged are lifted back up onto the cheekbones. Pulling your skin slightly up into the sides from the cheekbones often gives a rough indication of the results a mid-facelift can achieve.
I'm Dr. Kenny Levine. Welcome back to Health Talk. I'm here with Dr. Jason Altman, plastic surgeon to the stars. Jason, we talked a lot about from here to here. Let's talk about the face. You know, you did a lot of training on the face, and talk about what's available for our patients today.
Sure. I think of the face as in two sections. There's what we call the aging face, or the rejuvenation of the face.
Right.
Those are the things like facelifts, eyelid surgery, referred to as blepharoplasty, eyebrows, foreheads, and necks. In addition to that, we have the cosmetic surgery of the face, primarily rhinoplasty and surgery for the ears. My background gives me a unique perspective on a lot of this because I have that ear, nose, and throat training on top of the cosmetic training. Especially with the nose, it allows me to treat both functional problems of the nose, breathing problems, snoring, as well as cosmetic problems with the nose.
You know, I know a lot of people are concerned with bumps on their nose when the nose is too big, and a lot of people have internal problems where they can't breathe. I have a deviated septum. If I get a cold, it's always on the left side because that's narrower.
Right.
Let's talk about how you combine those
Sure.
procedures.
So they naturally combine with each other because the cosmetic aspects of the nose require us to do work on the bones and the cartilages of the nose, including the septum. And the airway is intimately related to all those features. Straightening the septum can both help straighten a crooked nose, but it can also help open the airways. Reducing the size of the turbinates, or the internal tissue of the nose, again can help open that airway, while providing more support for the nose to the tip and to the top or the dorsum of the nose can help maintain the valves or the airways of the nose open while you breathe. And all this can be addressed at the same time you do things like reducing a bump or defining the tip, making the tip smaller. In fact, it's very important to remember that airway is a functional part of the nose when you are doing these reduction procedures, because you don't want to leave someone with a beautiful nose that doesn't work.
Doesn't work. Right? A lot of things I want to talk about. We have to have you back.
My pleasure.
When you want to, patient comes to you and they have an option of a temporary fix like a Botox, or they need something more lasting and it's going to be a bigger procedure. How do you have that discussion?
I think it's really important to listen to what they're looking for. I think it's very easy to try to force your opinions or your aesthetics onto the patient, but the reality is what I'm doing as an aesthetic plastic surgeon, I'm not saving lives. I'm helping people achieve happiness through their own fulfillment of their desires of what they feel is wrong or right with their body. And so the most important aspect of that consult is to spend your time listening to what they want to change and what bothers them, and then helping them find the right solution for that.
You know, you talked about other parts of the body. I told you when I was driving in Aventura, I saw a big billboard for a Brazilian butt lift.
Yes.
Which is very fashionable today. You want to talk a moment about that?
Sure. The Brazilian butt lift refers most commonly to something we alluded to a little bit earlier, removing fat from certain parts of the body and putting it into other parts of the body. When done properly under the right conditions, it's a very successful operation. It does carry risks with it, like everything we do. My biggest concern with that operation is that it falls under the category of liposuction very frequently in the doctor's description. And there's so many doctors, especially in my area, Miami, that don't have the proper training, that aren't board certified plastic surgeons that are performing these operations. And I think it's very important for the patients when they do this to do their research, look at the backgrounds of the doctors and their training, make sure they didn't learn how to do liposuction over a weekend.
Tell us quickly where people can find you.
The office is located at 475 Biltmore Way in Coral Gables. The phone number is 305-501-2400. And the website's very easy to remember. It's www.psi-Miami. That's the Plastic Surgery Institute of Miami.com.
Great. Okay. Well, I think we're about at a close. There's so much more I want to talk to you about, so we're going to have to get you back. Jason, thank you for visiting.
Dr.
And I will
Levine, it
see
was a
you
pleasure.
real soon.
Thank you very
It's
much.
Dr. Kenny Levine with Health Talk. We'll tune in next week and we'll talk about other parts of the body. Thank you.